Welcome to Pregnancy Chat. I'm Monica, and today we're going to be talking about spotting during pregnancy. Before we get started with today's video, I want to invite you to sign up for Pregnancy Chat, where it's our mission to nurture you through your pregnancy and childbirth. Just click the link below to sign up at PregnancyChat.com. Spotting is a term used for light vaginal bleeding. This bleeding is lighter than a period, and spotting may be brownish, pinkish, or red in color. Spotting during pregnancy is quite common, and as many as 20 to 30% of women will experience some spotting during their first trimester. Usually around day 8 to day 10, after ovulation, when the embryo is burrowing into the lining of the womb, a little bleeding or spotting may take place. Sometimes this leads a woman to think that this is her period and that she is not pregnant at all if she isn't experiencing any other symptoms. As alarming as bleeding can be, it is usually nothing to worry about. You may be offered an ultrasound just to ensure there is a gestational sac with an embryo, and if you are far enough along, a little heartbeat. This is quite reassuring. Women who conceived with the help of fertility treatment are more likely to experience spotting. If 2 or more embryos were placed into your uterus and one stops developing, this may trigger a small bleed due to the loss of an embryo. This loss is called the vanishing twin. Contact your place of treatment for advice. They may advise you to have an early ultrasound. Multiple pregnancies are at a greater risk of miscarriage. Some women worry that having an ultrasound will increase their bleeding or indeed cause a miscarriage, because in the early weeks of pregnancy, an ultrasound is usually performed internally. I can assure you that there is no danger of this happening due to a transvaginal ultrasound. Try to remember that bleeding in early pregnancy is common, and even if it is heavy, does not mean the pregnancy is over. Investigation is worth it for the peace of mind it offers. The most common causes of spotting are, irrespective of the stage of pregnancy, spotting or bleeding should be mentioned to your doctor. More often than not, spotting will be nothing to worry about. During the first few weeks of pregnancy, the 2 main causes of spotting is breakthrough bleeding and implantation bleeding. Breakthrough bleeding happens when you would normally expect to have your period. This can therefore happen at 4, 8, or 12 weeks. This bleeding is usually lighter than a menstrual period. It is possible to experience breakthrough bleeding more than once. In a small number of cases, repeat breakthrough bleeding leads women to believe they are not pregnant when in fact they are. Pregnancy and the hormone progesterone stimulates the growth of rich blood vessels that nourish the lining of the womb. When a fertilized egg, a blastocyst, embeds into the lining of the womb, it may cause a small bleed. This small bleed is called implantation bleeding. For some women, implantation bleeding is a small amount of brown blood, but for others it may mimic a period and be bright red. Implantation bleeding occurs during the first few weeks following conceptions and can be one of the first symptoms of early pregnancy. Other possible causes of bleeding. Though breakthrough and implantation bleeding are the most common, there are other causes for spotting during early pregnancy, including irritation to the cervix. Pregnancy hormones can make the surface of the cervix more sensitive and fragile, and this can cause bleeding when irritated. Intercourse, the cervix softens, and the increase of blood flow to the area can cause sex to irritate the cervix and cause bleeding. Although this is probably nothing to worry about, you should abstain from intercourse until you have contacted your doctor or the bleeding has stopped. A vaginal infection such as thrush can cause mild spotting. A chronic medical condition and/or medication use can cause bleeding during pregnancy. A trauma to your belly, such as might happen in a car accident. Ectopic pregnancy and early miscarriage. Ectopic pregnancy. Though rare, bleeding during pregnancy can be a symptom of ectopic pregnancy. An ectopic pregnancy is when a sac and embryo embed within the fallopian tube, adjacent to an ovary, or sometimes within the abdomen. The symptoms of ectopic pregnancy may include abnormal vaginal bleeding, abdominal pain, usually felt on one side, but not all ectopic pregnancies cause pain until rupture. Symptoms usually occur between 4 to 8 weeks after the last menstrual period. Some women do not experience any symptoms, and the ectopic pregnancy is picked up during a routine early ultrasound scan. An ectopic pregnancy that happens within the fallopian tube can cause the fallopian tube to rupture, which can be life-threatening. Because of this, it is important to remove an ectopic pregnancy as soon as possible. An early ultrasound will determine whether or not there is a sac growing within the uterine lining. If one is not seen, you may be offered a series of blood tests to determine your level of HCG hormone. This will help determine whether there is an ectopic or that the pregnancy has failed. You have an increased risk of ectopic pregnancy if you have had an infection in your fallopian tubes, a previous ectopic pregnancy, or previous pelvic surgery. Early miscarriage. During the first trimester of pregnancy, there is a complex sequence of events, so it is not unusual for complications to occur. If a pregnancy ends before the 20th week of pregnancy, it is called a miscarriage. As many as 15% of confirmed pregnancies end in miscarriage, and the loss rate is estimated to be 2 to 3 times higher with very early pregnancies where you may not realize you were even pregnant. Bleeding in early pregnancy can be a sign of miscarriage. Rather than light spotting, the vaginal bleeding will grow heavier over time and be accompanied by abdominal pain or cramps. You may also notice clots or tissue being passed. Sadly, most miscarriages occur within the first 12 weeks and cannot be prevented. What should you do if you notice bleeding? You should contact your doctor immediately, even if the bleeding has since stopped. They will want to make sure there is nothing to worry about. Take note of the following. It may be important for your midwife or doctor. The color of the blood. Was it brown, pink, or red? The flow. Was it heavy or light spotting? Did it contain clots or tissue? Always wear sanitary napkins so you can monitor how much bleeding is occurring and the consistency of the discharge. Were there any symptoms? Did you experience fever, chills, dizziness, or pain? Your healthcare provider may be able to determine that everything is okay simply by asking a few questions, or may wish to carry out a more thorough investigation. You may be offered a vaginal exam, or depending on how far into the pregnancy you are, an ultrasound scan to check that the pregnancy is developing normally and in the right location. Blood and urine samples may be taken to check your HCG levels. This pregnancy hormone increases rapidly during the first few weeks, and a slower increase of beta-HCG may indicate a problem. Your healthcare provider will probably advise you to wear a pad if you are still bleeding. You should monitor your blood loss, but most women find the spotting lessens over time. Avoid tampons and douches. Avoid intercourse until the bleeding stops. In extreme cases, you may be advised to avoid sex until later in the pregnancy, but this will depend on your individual diagnosis. You may also be advised to rest and avoid heavy lifting. When to go to the emergency room? You should head straight to the emergency room if the spotting is accompanied by any of the following symptoms: severe abdominal pain or cramping, significant vaginal bleeding, passing of tissue or clots, dizziness and or fainting, a high fever and or chills. Spotting during the second and third trimesters. Spotting or bleeding in the second and third trimesters should be considered more serious, especially when no bleeding has occurred prior to this point. If you experience spotting after the first trimester, you should contact the hospital immediately. Possible causes of spotting and bleeding later in pregnancy include placenta previa. This is where the placenta begins to cover or partially or fully cover the internal cervix. The first sign is usually one or more episodes of painless bleeding. This condition requires close monitoring. Placental abruption is a condition where there is bleeding between the placenta and the uterine wall. This condition is usually accompanied by vaginal bleeding and some dull or sharp abdominal pain. Your mucus plug. As you approach the end of your pregnancy, spotting could be a sign that you have lost your mucus plug. The mucus plug keeps bacteria away to protect your baby's environment and is located at the internal opening of your cervix. The mucus becomes dislodged as the cervix begins to soften and dilate. This thick mucus plug may be noted as a brown or red tinged discharge. It is possible to lose your mucus plug 2 to 3 weeks before labor begins, but normally labor begins within a couple of days. Many women don't even notice that they've lost their mucus plug, as it can fall into the toilet unnoticed. If you lose what you think is your mucus plug and you are not yet 37 weeks, contact your midwife or doctor immediately. It may be a sign of preterm labor. I hope you enjoyed this video. Please click the link below to sign up for Pregnancy Chat, where it's our mission to nurture you through your pregnancy and childbirth. If you know someone who might benefit from this video, please share it. And if you have any comments or questions, please post them below or post them at PregnancyChat.com. Thanks for watching. I'm Monica Healy, and we'll see you next time.